As the coronavirus sweeps across Africa, there's a fear that the ailing health sector could creak. The virus has spread throughout 52 countries out of the 55 on the continent, with both confirmed cases and deaths surging every day. Governments have responded in differing degrees, from shutting down international airspaces and borders to imposing curfews and lockdowns. The virus has confined everyone in their places, with life as we know it coming to a grinding halt. However, the pandemic has specifically renewed debate about functional healthcare systems, especially in Africa, long ignored or neglected by policymakers who frequented first-class hospitals in Europe and Asia. The coronavirus pandemic means they can no longer escape, and if anywhere to get sick, they will have to rely on the very weak health systems for their survival. For instance, the Uganda Virus Research Institute is a symbol of resilience and holds the country's research lofty dreams. But as one of the leading research institutes in Africa, it operates on a shoestring budget, as chronic underfunding has become a figure of speech, a metaphor for the country's misplaced priorities. Uganda Virus Research Institute is currently the only specialized health research institute in the Great Lakes region that has trailed the blaze on viral hemorrhagic fever and airborne viral diagnostic services. It's currently the only center with testing laboratories for coronavirus. In the current financial year, it was only allocated a paltry 9 billion shillings, up from 6 billion shillings in the last financial year 2018-2019. However, by last September, documents reveal that only 961 million shillings had been released to the facility. According to the latest Auditor General's report, the Virus Research Institute had an approved structure of 237 positions. Out of the 237 approved positions, only 88 or 37% were filled, and 149 positions remained vacant as at the time of the audit. Yet government in its policy documents says it plans to reposition Uganda Virus Research Institute into a dynamic, internationally competitive research institution, contributing to the global challenges of addressing communicable diseases in order to achieve the SDGs and contribute to economic growth and development knowledge. Besides the sheer neglect, most African countries' health budgets are majorly funded by Western donor countries like the United States, European Union, and World Bank, as many governments turn to spending massively on defense, energy, and infrastructure. According to Moses Mulumba, the executive director of the NGO Center for Health, Human Rights and Development, which advocates for equity of the right to health, the crisis at hand is a time for reckoning.
We've been monitoring the health budget. We never get what the sector wants all the time. The sector gets less. In fact, the health financing strategy is very interesting because it gives a background on health financing. And it talks about the fact that when you look at health, unlike sectors like road and energy, which have seen their budget move from 18 to almost 25% contribution, the health sector has stagnated where it has actually been for the last 5 years or so. We do not exceed 7% of the national health budget. Economists will say it's not the best measure for funding, but I think for us, that's what we see.
Mulumba says the anemic financing has crippled several aspects of the sector as government left the donors to fill the void.
The overall dependence on foreign assistance is increasing every day. So the money which is funding the health sector is either from Global Fund, from gov't, and all these initiatives. And we see that even NGOs and mission hospitals are contributing 30% to the health sector. Now, you can equate that to a situation where a man is not able to give his family food, but a neighbor always feeds his family. You cannot dictate when then the meat will be provided.
In his televised address on Wednesday, President Museveni praised Uganda's response system of testing suspected COVID patients and timely return of the results at Uganda Research Virus Institute as impressive.
No, Uganda is very prepared. Is very prepared in the biggest element of preparation, of preparedness. We had the outbreak of Ebola, I think it was 2001, where we lost Dr. Lukuya in Lacho. At that time, we had nowhere to test Ebola or a disease like this one, COVID. We had to take the samples to Atlanta, Georgia, in the USA. The only other testing center was in South Africa. Starting with 2007, we had built a capacity here, working with the Germans. Then later on in 2010, the CDC of the Americans also joined us. So these tests I'm reading to you are all done here.
The robust response system at the Virus Research Institute was, however, reinforced by the US government through its Center for Disease Control and Prevention, which also pulls a sizable chunk of its working budget. Since establishment in 1936 for human and animal communicable diseases study, the Virus Research Institute underwent years of neglect until the Americans stepped in 2010, and since then it has been at the forefront in combating Uganda's sporadic viral hemorrhagic outbreaks from Ebola to Marburg to Crimean Congo fever. While government has availed billions needed for the COVID emergency, the US is still playing a pivotal role in the background, including having established virtual platforms for the health ministry meetings and communication. It has also procured IT hardware to improve communication amongst hospitals and district officials, and now is working to expand virtual learning and telemedicine platforms to regional referral hospitals. The Health Minister, Jane Ruth Acheng, told NTV that government needs every support.
Because of the pandemic and because of the challenges surrounding the pandemic, the virus attacks quite fast, it spreads quite fast. Countries need whatever resources they have. So it is not possible for one country to support another. Each government has to rise up to the challenge on its own. And the challenge is huge. So when you have partners coming to support you even with little resources, you say thank you.
The questions about Uganda's broken health system notwithstanding, Dr. Cheng says government has been able to weather the storm.
I want to believe that government has done really well with this pandemic. Like I said, it is huge. And not one sector can respond alone. It is a multi-sectoral response. And that is why we have it coordinated at the level of the Prime Minister. Because when you move into a pandemic where you have to have a lockdown, that calls in all the arms of government to come in and respond. So the component of health is responding to the patients, identifying the contacts and managing them, and ensuring that the health facility continues to provide services.
Generally, the US pulls a sizable chunk of Uganda's health sector budget. For instance, of the $896 million or 3.3 trillion shillings in aid to Uganda in 2018, $511 million or 1.9 trillion shillings went to the health sector, specifically to interventions in HIV, malaria, tuberculosis, and other communicable diseases, maternal and child health, nutrition, and health systems strengthening.
The people who are funding the health sector will determine what the priorities are. So when a crisis like COVID hits, you then find that the very basic things that would prevent COVID, these are community systems. They are never funded. So we have seen that the funding to the health sector is very disease specific, but not the systems which would actually prevent the disease. Look at the funding that goes to the health unit management committees, for instance. This is the first structure where you would actually prevent the spread of the disease. But the health unit management committees almost don't receive resources all the time. They are always in deficits. And this is the community structure. Including WHO, it is telling us that if you do not mobilize at the community level, you are not going to be able to control the disease.
However, government has equally been scaling up the health sector budget, albeit marginally, according to the analysis of the financial year reports. In this financial year, health was allocated 2.5 trillion shillings, up from 2.3 trillion shillings in the last financial year, 2018-2019, of which 58% was from government and 42% by external financiers. For the next financial year 2020-2021, the health sector was allocated 2.8 trillion shillings out of the 45 trillion shillings resource envelope, which though represents a 7.9% increment, upset MPs on the budget committee on Thursday during interface with finance ministry technocrats.
COVID can be used as an opportunity by legislators and all concerned, once and for all, to fix the health sector. I would have loved an approach that holistically takes that way. That we've been trying to fix roads, trying to fix power, we've been trying to fix other things, but now reality has come to us that we must, as of necessity, strategically go in all out to fix the health sector.
Let's not talk about the donors, our partners are going to give us money. We are not going to talk on borrowed salt to look after our visitors. You must have your own salt in the house first. So what have we prepared for COVID before we look outside at what our partners are going to do for us? So, Mr. Chairman, I think that health provision must change upwards. I think it is wrong for us to put it at 7.8. It must change to prove that we are serious and we are focusing on health at the moment.
What we are going through is a clear indication that if you don't care for your health, even the economics, you will be counting nothing. We have a lockdown because of health issues. So everyone is not functioning. So I'm not going to propose that we do a 6 trillion budget and we put in Ministry of Health. No. But when you look at what Ministry of Finance is proposing, there is nothing that has changed. We are not learning from what we have. Even there are 100 ambulances the president is raising, there won't be fuel to run them. I don't want us to concentrate on only COVID. But if COVID ends next month, what happened to those ambulances? Health center forces are not functional because finance has not availed money to recruit anesthetic officers who were trained by government. Mulago Super Specialized Hospital is not operational because there are no resources. And it's not a lot of money. Health promotion, which should be helping us to prevent problems, it has 200 million shillings. National medical stores, the HIV and TB budget is fully supported by the Americans.
A quick review of government policy documents offers mixed results, particularly of a system changing for the better. However, it is until one spends time on the ground that they get a clearer picture. This has come to light after the newly appointed Junior Health Minister in charge of general duties, Robin Anabanja, recently carried out a countrywide tour. Last Tuesday, the minister visited Mityana General Hospital, which was amongst the dozen health facilities recently renovated and refurbished by government using a 490 billion shillings credit line from the World Bank. However, during her visit, she found that many health workers had not turned up for work. During a visit to Fort Portal Regional Referral Hospital last month, she found casual workers providing essential services as the medical personnel were absent. The shutdown is already straining the ailing health system. Stories are abound every day of health facilities operating short of medical personnel or being overwhelmed by patient numbers, expectant mothers stranded or delivering in the worst case circumstances, the shortage of the ambulance system, and the shortage or lack of personnel, proactive equipment like gloves and masks. A review of several government documents shows that absenteeism and understaffing are amongst the major problems plaguing the health sector. The 2018-2019 Ministry of Health Sector Performance Report shows that the stock of qualified health professionals available for employment in the health sector stood at 107,284 in 2019 on the account of increase in production from pre-service training of categories such as nurses, midwives, laboratory staff, and clinical officers. According to the Health Ministry, there are at least 39 districts which do not have a hospital at all. 29 constituencies don't have a health center for. 331 sub-counties have no health center 3s but have health center 2s which can be upgraded, and 139 sub-counties do not have a health facility at all. Dr. Olive Kobusinje, the author of the book The Patient, Sacrifice, Genius and Greed in Uganda's healthcare system, told NTV the center is plagued by deep-rooted problems.
I think if there's ever a wake-up call, this is surely it. There have been many recommendations about how much in terms of financing needs to go into health. In Uganda now, I think in the current financial year, we have probably 6.7% of the budget going into health, as opposed to a reasonable 15% is what has been recommended by the African Union. So we have been underinvesting in health, and I think really the main reason being that the people who have the power, who determine what money goes into the health system, don't ever use this health system. They really have absolutely no motivation to improve it.
She says the dysfunction of especially the ambulance and referral system is a major dent, which means patients are condemned to death. There are several interventionist efforts by government, such as revamping the 13 regional referral hospitals in the country, which provide a wide range of services like imaging, diagnostic, intensive care, and dialysis. But until government addresses the human resource aspect, reinforced by better training and remuneration to correspond with a growing population, every commendable effort will come to naught.
What is given to the health sector is not adequate. The health sector is huge, really huge. If we were to give the 15% that generally we talk about, then other sectors would be deprived of money. And I want to believe that if we are done with the infrastructure, the roads, the railways, and so on, which will bring in a lot more money, the health sector can get. Because mind you, whatever money you invest in the health sector, you cannot see its returns immediately, but you see it in the long run. But seeing it in the long run quickly translates into productivity. That is why it is good to invest in health.
For years, government has spent considerably on treatment of senior government officials and other VIPs abroad as a result of the failure to invest adequately in the healthcare system at home. But if there's one lesson the current crisis has brought to the surface, is that an investment in health is perhaps the most critical to anchor the well-being of the society.